Hi, everybody. Welcome to Managerial Epidemiology and to the spring 2019 semester. I'm your professor, Sarah Bonzo, and looking at the course roster, I've had a number of you in other courses, many of you from health systems in the fall, which will actually position you really well. Those measures of use that we covered in the second half of the semester will parlay into the work that we're going to be doing in this course as well. For those of you that haven't taken that course, don't worry about it. You'll get everything you need in this course to help you make sure that you can do all of the analysis, especially for the final project. But if you have any questions along the way, please let me know. To get started with a course, make sure that you go through, look at the entire course shell, at the content, at the learning modules. Make sure that you also download the syllabus. This is going to be your guide to the course with everything from learning objectives to what's most important is on the second page, our course schedule, which goes down through the learning modules, the topics in detail, as well as important due dates. This course is asynchronous, which means that we are not in person together. It's part of the Open SUNY platform is that we want to be able to provide this coursework to people who have jobs and families and may actually be in different time zones. So as such, we're not allowed to require a synchronous component, meaning that we're all going to be in the same place at the same time. But what I do want to do is to meet each of you to get to know a little bit more about you. For those of you that have taken a course with me before, we've done this, but I still want to have that time with you to talk through where you are with your coursework, what you're focusing on, what to expect in this course. And the other reason for us having that one-on-one time is also to figure out what you want to work on for your final course project. So I'll talk a little bit more about that in just a moment. But one of the things I do want you to do is to schedule a meeting with me. That has to be done by February 25th, so you have some time, but just start thinking about when that would work for you. I will include on the announcement a link to my You Can Book Me page. You can go on there and book time with me anytime during the day, Monday, Wednesday, that's when I'm in the office. But if those times aren't going to work for you, just shoot me an email and we can figure out another time that would work for you based on your schedule. So for that one-on-one meeting, we'll be using Zoom. Zoom is a conferencing platform. It's how I'm recording this video right now. It's a wonderful tool. A lot of organizations are starting to use it. Even if you don't have team members in different locations, it's just really useful for having a quick get-together that doesn't require you to leave your office. A great way for also presenting data, and we're going to be using it for our final course presentation and project as well. So I want you to get some experience with it up front. So we're going to have our one-on-one meeting, but to kick off this course, I'd also like for you to do a brief introduction, just a couple minutes, who you are, where you work, what if you're not working now, what experience you have, and why you're taking this course and the broader program that you're in. I think that's going to help us get an appreciation for one another and our perspectives as we're coming into the course discussions. In terms of the content that we'll be covering this semester, so managerial epidemiology is really a blending of this clinical epidemiological component, which is usually for those of you with a clinical background, you've probably taken a number of epi courses already. This one blends kind of how we're planning and preparing to deliver healthcare services with those same epidemiological principles. As such, the course is broken down into two main sections. The first is going to be a focus on the more traditional epidemiology content. So we'll be talking about infectious disease, chronic disease, person, place, and time. So all of those components that are really important in having us understand how disease progresses, either with an individual or through the population. We'll also be talking about analytical epidemiology. How do we analyze? How do we screen for disease? That's really going to be the focus of the first few modules, the first half of the course. And the modules will be a combination of having discussions where you read a little bit about a topic, I pose a question, and you're all going to have a response. Please make sure in your responses that always that they're respectful to other people and other perspectives and that you're bringing in valid sources. So I'll give you a lot of feedback after the first discussion. If you have any questions, again, let me know. There'll also be some homework assignments where we're testing, your ability to use screening for disease and understanding some of those other concepts of analytical epidemiology. Then we're going to transition in the second half of the course to that managerial epidemiology piece. And that is going to be focused on doing a certificate of need analysis. So New York State is one of 35 states that still uses certificate of need. Basically, it is a requirement through the state that any hospital or healthcare facility that wants to add inpatient beds has to go through and get approval from the state to add those beds. Now, this goes back to an act that went into place in 1974. So even though a lot of things have changed, that was put into place because the states didn't want to have excess capacity in our hospitals, because that should theoretically then jack up prices, right? And is in an effort to kind of rein in some of those healthcare costs, they put into effect these certificate of need requirements. So you will be acting as the CEO, and you will be going through this certificate of need process to try to determine, for a hospital of your choosing, in a county of your choosing, whether or not for a specific service line in that hospital, you should be adding or reducing beds. Now, in order to do that analysis, we're going to be using the Department of Health Sparks dataset. You will be using actual real data from either, we've been using the 2015 data, I may update it to 2016. We'll be using that data and looking at how the population uses health services within your county and at your hospital specifically. We'll be looking at population trends and try to figure out whether or not it makes sense for us to add or reduce beds for that service line. So this is usually a very arduous process that hospitals need to go through. It's good to get this experience, but I think from my perspective, what I think is more valuable is really your ability not to make a pitch for adding or reducing beds, but understanding the needs of your population. As we focus more on population health, we need to understand what's happening in our communities, what services people are going to need, and we need to plan for the future in that way, using that data to inform whatever we're going to do. The other added benefit of this is hopefully you'll get some new technical skills. I know some of you have proficiency in Excel already and know how to use pivot tables, but for those of you that don't, that is something that you will learn throughout this process. The other piece that I try to pull in this project is data visualization. More and more as we're giving presentations, and especially if you're in a leadership position, we want to make sure that the data that you're presenting easily tells a story, right, and is compelling and clear. And as part of that, we'll be using the Tableau software to help support that data visualization and making graphs and other visuals that are going to help convey your message. And again, that is a final course presentation that you'll be giving via Zoom, and I'll have lots of content that'll be coming to help you work through that project as well. So as we get started, please again look through the course and don't hesitate to reach out to me if you have any questions. Thanks.